Hi, my name is Justin. I'm going to be doing a head, ears, eyes, nose, and throat assessment on my patient KM here. Hi, KM. Can you just verify your name and date of birth for me?
KM 33086.
Okay, great. All right, so I'm just going to ask with a few questions. I'm going to start off by asking you a few questions, okay?
Sure.
All right, so have you had any chronic headaches or recurrent headaches?
No.
Okay. Do you have a history of any head injuries?
No.
Dizziness?
Nope.
Lightheadedness? Any trouble with your balance?
Mm-mm.
Okay. How about pain when you're moving your head
Nope.
in your neck at all? Okay. Have you noticed any lumps or swelling
No.
in your neck or your throat?
Mm-mm.
Okay, great. So now I'm going to move on to inspection of her skull. I'm just going to look at it and I'm going to palpate her skull as well. So I'm going to just look at your head and feel around in your top of your head, okay? So I'm looking at her skull. Noticing that it's oval shaped, it's round. I'm not noticing any deformities. Her hair distribution appears to be even and appropriate for her age and gender. It's well cared for and groomed. The size of her skull appears to be proportionate to her body, as I would expect. Her skin is pink and dry. I'm not noticing any excessive sweating or lesions on her face or on her scalp at all. So now I'm going to palpate. So I'm going to palpate the top of your head, okay?
Okay.
Feel around. Let me know if you have any tenderness.
Nope.
Okay, so I'm not feeling any masses or lumps. There's no soft spots, no deformities. I'm just going to feel the artery here. I'm palpating the temporal artery. Okay. Okay, I can appreciate both of those. The temporal artery on both sides. Now I'm just going to feel the joint here at your jaw. Can you open your mouth for me? Close it. Any pain while I'm doing that?
Nope.
Okay. So she has full range of motion of her jaw. The TMJ feels. I'm not feeling any crepitus or masses there. So now I'm going to take a look at her face. So, Kristen, I just want you to smile for me. Raise your eyebrows. Puff your cheeks out. Okay. So her facial movements are symmetrical. She's able to respond to my commands and do what I'm asking. You didn't have any difficulty or pain when you were doing that?
No.
Okay, great. So that would be testing cranial nerve number 7. Cranial nerve number 7. And also, looking at her face, I'm noticing that her skin is pink and dry. I think I said that earlier, but yeah. So now we're going to move on to your neck. I'm going to start by having her move her head around, and then I'm going to palpate. I'm going to palpate some lymph nodes. I'm just going to feel lymph nodes for any swelling. And I'm also going to feel your trachea. I'm going to assess the position of her trachea. Okay, Kristen, can you just tilt your head to the left and right, front and back? And rotate your head left and right. Any pain while you're doing that?
Nope.
Okay, so she has full range of motion of her head and her neck there. So now I'm going to move on to palpation. All right, Kristen, I'm just going to feel your throat here. So I'm feeling her trachea. It feels midline. I can feel the rings, the cartilage rings there. I'm not noticing any masses or deformity of her trachea. Okay. So now I'm just going to feel some lymph nodes, okay? So I'm going to feel the preauricular, postauricular, occipital, submandibular, submental, tonsillar. Okay, and now I'm going to move on to her cervical lymph nodes. I'm feeling the posterior, the deep lymph nodes, and superficial lymph nodes. And now supraclavicular. Okay. So I'm not noticing any swelling in the lymph nodes there. You didn't have any tenderness while I was feeling around there?
Nope.
Okay, so she has no pain or tenderness. And what I'm doing here is I'm combining the uh, head and face assessment with the eyes, ears, and nose assessment. I think that's what we're supposed to do to make it all one HEENT video. So again, we're just going to ask a few more questions. I'm going to ask some questions about your sight, your smell, things like that. Okay. So have you noticed any difficulty in your vision or blurred vision?
Nope.
Anything like that? Any trouble seeing things close up or far away?
No.
Any changes in your visual acuity? Okay. Have you noticed any excessive watering or redness in your eyes?
Mm-mm.
Any drainage or discharge? Any pain?
No.
Or like you feel pressure behind your eyes, anything like that? Okay. Do you wear glasses or contacts?
I do wear contacts.
You do wear contacts. Okay. And do you get regular eye examinations?
Yeah, every year.
Okay, good. So your contact prescription is up to date.
Mm-hmm.
You're doing well with that.
Yep.
Okay, great. So with your hearing, have you noticed any changes in your ability to hear?
No.
Have you noticed any constant ringing in your ears? We call it tinnitus.
No.
No. Any pain in your ears or
Mm-mm.
any history of chronic ear infections?
No.
Did you have tubes as a kid in your ears?
Mm-mm.
Okay, good. Do you ever feel dizziness, like uncontrollable dizziness and nausea?
No.
Call that vertigo. You kind of feel unbalanced.
Mm-mm.
Okay, great. So the room's never spinning for you.
Mm-mm.
Okay. I already asked about ear infections. How about any like discharge or drainage from your ears?
No.
Excessive earwax, things like that.
Nope.
Okay. So now we'll move on to the nose. Have you noticed a change in your sense of smell?
No.
Any sinus pain around your nose?
No.
Any excessive drainage like snot or
No.
any production like that? No. Can you close one nostril for me? Breathe in and out. Other side. Okay, so both nostrils appear to be patent. I'm not seeing any drainage coming out. Have you noticed that you've been getting nosebleeds?
No.
No recurrent nosebleeds? Okay. How about any chronic colds or congestion?
No.
Have you ever had hay fever?
No.
Okay, so that's it for your nose. We're going to move on to your mouth now. Have you noticed any changes in your sense of taste?
No.
Any bleeding gums?
Mm-mm.
Any sores in your mouth?
No.
Any major dental procedures?
Nope.
Okay. Have you noticed any changes in your voice?
No.
How about sore throats?
No.
Any lesions?
Mm-mm.
I already asked if you had any sores. Okay. All right. So that's good for your eyes, ears, nose, and throat. So now we're going to move on to inspection. I'm going to inspect her face, her skull, all those things, kind of like I did in the previous segment of this video. So again, I'm inspecting the size and shape of contour of her skull. It appears to be appropriately sized and proportionate to her body. Your facial expressions, you can smile and puff out your cheeks and raise your eyebrows. Okay, so facial expressions are symmetrical. I'm not noticing any lesions on her face and the skin. If I had an ophthalmoscope, I would be using that right now to just look at her eyes. I do have a pen light. Whoops, sorry. So I'm looking at her cornea, not noticing any lesions or no marks. The sclera is white. The cornea appears to be clear. The conjunctiva is pink. There's no discharge, no lesions there. I'm going to take a look at her pupils. I have a pen light here. All right, Kristen, so just look at my nose for me. Okay, so her pupils are reactive to light. I would size them at around 3 millimeters. Now I'm going to do the corneal light reflex. Okay, so I'm seeing the light in both eyes at around the 1 o'clock position. So that's an expected finding. If I had the ophthalmoscope, I'm going to pretend here, I would look into her eyes. Look into her eyes, okay? And I am noticing the red reflex in her eyes if I had the ophthalmoscope. Eyes. I'm going to test her eye movement. So just follow the tip of the pen light here, okay? Okay, so she was able to follow the pen light, no problem. So you didn't have any pain when you were doing that?
No.
Okay. So her eye movement seems to be as expected. Not have any difficulty with that. And she was able to follow the pen light. I made an H shape and she followed it. So now we're going to move on to her ears. I'm going to inspect the outside of her ear. So I'm just going to take a look at your ears here. Okay. So the auricle is in line with her eye approximately on both sides. That's an expected finding. Just look at my nose here. So her ears are symmetrically positioned on either side of her head. Not noticing any lesions. The skin is pink and dry. They appear to be proportionally sized to the rest of her head. Now I'm going to look inside of her ears. I'm just going to look at your ears. Okay. Okay, so the auditory canal appears to be patent. If I had a scope, I would be able to look in there a little better, but I don't have one. I would be inspecting the tympanic membrane, looking for like an oval shape, and it's a grayish dull color. That's what I would expect to find. Maybe some cerumen in there, but I'm unable to do that because I do not have a scope. But now I'm going to do the whisper test. So Kristen, I just want you to hold one ear closed for me. I'm going to say a few words and I just want you to repeat them, okay?
1, 2, 3.
Okay, and then cover the other ear.
10, 11, 12.
Okay, great. Okay, so she was able to repeat back the words that I said, so she passed the whisper test. So now I'm going to move on to her mouth. I'm just going to take a look at her teeth and her gums and her lips, just to check those out. So Kristen, if you could just open your mouth for me. Okay. So I'm looking in her mouth. All of her teeth appear to be intact. Not noticing any dental caries, no bleeding gums. Gums are pink and moist. Her tongue is pink and moist. Can you stick your tongue out for me? Okay, tongue is pink. I'm not noticing any lesions on her tongue. I'm not noticing any deformities with her teeth. She does not have tonsils. You did have a tonsillectomy, correct? Okay, so she did have a tonsillectomy. I was not able to see tonsils because they're not there. The back of her throat, the pharyngeal wall, again, is pink and moist. I didn't notice any lesions there. There was no bleeding, no masses, nothing abnormal there. And her lips are pink and dry. They appear symmetrical on both sides. I'm not noticing any lesions or deformities. Okay. So now I'm going to look at her nose. I'm going to look at me. I'm looking, her nose is symmetrical and midline on her face. I'm not noticing any deviation of her septum. That also appears to be midline. Both nares are approximately the same size, and they appear to be symmetrical. Take a look up here. Okay, so the mucosa in her nose is pink and moist, and the turbinates, if I had a scope, I could look at those a little better, but the turbinates also appear to be pink and moist. So again, I'm going to move on to palpation. I'm going to palpate her head and face and her neck, and we'll test nasal patency, and we'll check for any sinus pressure and pain. So we're going to move on to that. Okay, so again, I'm just going to start here with her skull, feeling for any deformity, soft spots, masses, lesions. I'm not noticing any of those. Her skull is nice and round and oval shaped. Again, no soft spots. Did you have any tenderness while I was doing that?
No.
Okay, great. We'll move to the TMJ again. Open your jaw for me. Any pain there?
Nope.
Okay. So her TMJ is symmetrical on both sides. She didn't have any pain there. Full range of motion of her jaw. Now, Kristen, I'm going to have you close one nostril and breathe in and out. And do the same thing with the other side. Okay, so both nares are patent. I didn't notice any discharge there. So now I'm going to move on to palpation of her neck and throat. So I'm just going to feel here. So again, the trachea feels midline. I'm not noticing any deformity there. It seems to be firmly in place. I'm not able to move it around. Obviously, her trachea is patent because she's talking to me and breathing. The lymph nodes, I'm going to feel the submandibular lymph nodes again, submental, preauricular, postauricular, occipital, and then the cervical lymph nodes, deep, superficial, posterior, supraclavicular, tonsillar. Okay. So again, the lymph nodes feel, I'm not noticing any swelling in the lymph nodes there. Now I'm going to palpate her thyroid.
Mm-hmm. Oh, let me calm down.
Okay, so I'm just going to feel your throat again. So I'm feeling the thyroid. Any pain?
Mm-mm.
Okay, so I was able to palpate the thyroid. She had no tenderness there. I didn't feel any masses on her thyroid, and it did feel symmetrical on both sides of her throat there. And she denies tenderness on palpation there. So now I'm just going to push a little bit on your face here. I want you to let me know if you have any pain, okay?
Okay.
Or feeling any pressure. So now I'm just palpating her sinuses. No pressure.
Mm-mm.
Okay, good. So no tenderness on her sinuses there. I'm going to get my stethoscope. I'm going to auscultate her carotid artery.
It's in the car.
apologize, technical difficulty there. Okay, so I'm going to take the bell of my stethoscope and auscultate her carotid artery for bruits. Okay, so I did not hear any bruits. Nice whooshing sound was present. Now I'm going to move on to percussion. I'm going to percuss her sinuses again. So, Kristen, the same areas I was touching, I'm just going to do a little bit of tapping, okay?
Okay.
Okay, did you notice any pressure or pain there? Okay, great. And now we're going to move on to Vostek sign. Okay, so Vostek sign was negative there. I would have been looking for kind of like a little twitch response, which was not present. Okay. Do you have any questions for me?
No.
All right. That concludes our HEENT assessment. Thank you.